Sciatica. One of the most common causes of sciatica, probably causes over 95% of sciatica, is caused by a pinched nerve in the low back. These are bones or vertebra. The little sponges right here are representative of discs, and these little things are bundles of nerves. They call them nerve roots. Nerve roots are connected to the spinal cord and come out through holes in the spine. And what happens is if you crack a disc, they're fairly powerful and very hard to injure, but if you've cracked one in the past, they're made of water and they start to shrivel up and die and they start to shrink, and as they shrink, these discs shrink and the hole shrinks too, and so it starts to crowd the nerve. And if the disc fails, or if it swells, or if it in any way gets too close, even too close to the nerve, it'll interfere with normal nerve transmission. Now this nerve, and this nerve are the three nerves that primarily innervate the leg, the whole leg. So if you were to cut all three of these nerves, the leg would stop working and it would also be completely pain-free. However, if you just irritate the nerve or you get too close to it, what happens is the nerve starts to misfire. And that causes either pain or numbness or tingling or weakness in different parts of the leg, depending on which nerve you're pinching. The most common is L4. Now, chiropractic tries to relieve sciatica, and we have a great success rate with it, by taking the pressure off the nerve using adjustments or traction or some type of therapy. And depending on your success of the speed with which you recover is usually based on how damaged is the disc. If the disc has been slowly shriveling up for 20 years, it's going to take a series of adjustments to get it feeling better. If it's something recent, if the disc is still very healthy and strong, it's going to take 1 or 2 or 3 visits to get rid of sciatica. And that's why we take x-rays. The other thing you want to know about sciatica is the main reason these discs shrink is because there's an abnormal curvature in the low back. So we'll assess that too and see if you have the right curvature, the wrong curvature, a healthy disc, a skinny disc, and then we go from there.